5 things to know about vaccines. You know how important it is to make sure your children follow an immunization schedule, but did you know that there are life-saving vaccines for adults that are severely underused? As we said, as little as 2% of adults are immunized against an easily preventable illness. And our Dr. Marie Savard is here with the top 5 vaccines adults need to get, the 5 of them. And you said the first one is like really protecting against 3 diseases?
It is. Actually, these are so important, and important for women to listen to these vaccines because they're the ones who are going to ask their doctor to see that they get it or bring their partners in as well. So, number 1, everyone needs a combination of tetanus, diphtheria, and whooping cough or pertussis. They need it once. That's new because pertussis or whooping cough is actually on the rise, and there are even epidemics in some states. And it's kind of a subtle thing. You can chronically cough, very annoying, big problem. Then you need tetanus and a diphtheria for life every 10 years. Tetanus still occurs. It's older women that aren't immunized. We've got to make sure we get that tetanus shot. All 3 are bacteria that produce toxin, and they can be deadly if you don't get the vaccine.
Because if you're an adult and you travel, I know that I get those shots because I travel internationally, but I don't know if I would do it.
No, otherwise you may not, and your doctor may not remind you because they are busy. You've got to ask about this.
All right, the flu shot, we hear a lot about that. It's a little bit weird to be talking about the flu shot in the middle of July, though.
It's true, but it's important. You need it. People that are aged 50 and over, everyone. We should all get it every season, which means starting in the fall, it peaks in the winter. The side effects of the flu shot are mild, are nothing compared to the devastation of the flu. There were more flu deaths this past year. It's really important that we're vigilant about the flu shot, and if you have chronic illness or don't want to get sick, even get the flu shot if you're younger than 50.
And I think some people are going to be surprised to hear there's a vaccine for pneumonia.
Yep, that's right. A lot of seniors don't even know about this. 65 and over, you want to get the pneumonia vaccine. Bacterial pneumonia causes more deaths than even the flu, and it's especially devastating to older people. So if you get the vaccine once when you're 65, you may or may not need a booster in 5 or 10 years. And if you've had your spleen removed, if you're going to get chemotherapy, a lot of reasons why you may want to get that pneumonia vaccine, really important.
Shingles. Now, you normally think it's for, if you're, the only time I've really heard of it is with older people. But until recently, I've been seeing younger and younger people coming down with shingles.
Shingles can be a devastating disease. Everyone age 60 and over should ask for this vaccine. It's new. It's been around for 2 years. We know it reduces the risk of shingles by 50% or more. And more importantly, it reduces the risk of that painful neuropathy, that neuralgia that you can get that can last months to years. And people don't realize shingles is simply the chickenpox virus that we all had as young kids flaring up as our immune system gets less vigilant with age. So that shingles vaccine can boost that immunity and really help reduce the risk.
What about as adults thinking about measles and mumps and such?
Measles, mumps, and rubella, we call it the MMR vaccine. Remember it for kids, we forget for adults. Those adults who fall in the ages between age 19 and 49 need to ask about a booster because they may not be protected. They may have received the vaccine at a time too early in their life where they don't have that immune boost. Those of us who were born before 1957, I'm speaking for myself, we already are naturally protected. But for women who are in the childbearing ages, it's important that they get that rubella check in the blood if they're not sure. Because if they're not protected, they want to get that vaccine before they get pregnant.
You know, a lot of people are saying, this is great advice, thank you very much, but A, I don't have insurance, B, I have insurance, but it doesn't cover this.
Well, if you don't have insurance, and insurance will pay for most of these vaccines, or at least part of them, go to your neighborhood, the local public health department. They can help you and often give it to you free or at a discount. And then finally, please carry a copy of your own immunization records. No one has that information. Every doctor, it exists in piecemeal fashion. You are responsible to keep that information for your children and for you.
And not as much concern with adults vaccinations, because we hear, of course, with young people, with your babies and such getting vaccinated. It's not the same kind of concerns?
Well, in truth, you save thousands of adults' lives as a result of vaccines. There are always the local side effects and the concerns, but the bottom line is vaccines save lives. They're incredibly important. They've been around a long time, a huge help and to the safety of our older people, all of us as adults.
All right, Marie, thanks so much. And there are actually a total of 10 adult vaccines recommended by the Center for Disease Control. And to see a complete list, go to our brand new website at abcnews.com.
Friday morning, where's the only place to see the most popular girl on the planet?
Well, of course. Good morning, America.
It's Miley Cyrus.
Get ready, we're taking over morning TV.
This Friday, only on Good Morning America, presented by Listerine Smart Grid.